Hi, folks. This is Sarah Bingham. I am doing this for you because I have given this talk many times, and I give this talk free in Lakeland, Florida, but I'm just totally aware that there's a whole lot of mothers out there that have a hard time getting out, and I'd like to reach you. I'd like to be able to just share this information with all parents so that you begin to get an idea of what's going on with your child and probably your own body. So I'm using this wonderful program to do this, and I wanted to give you a little bit of my background. You can find a lot of my background on my website, the www.fastfoodhealing.com. But I can tell you that when I studied with Dr. Campbell McBride, I just got very excited because what I found was a woman. Now, Dr. Campbell McBride is a Russian trained neurologist with another postgraduate degree in nutrition, and she practices in Great Britain. But what I love about her is she's a woman, she's a mom, and she gave birth to a little boy that was diagnosed autistic. She got pretty frustrated, and this is over 20 years ago. Dr. McBride got pretty frustrated with the medical society. She just could not get anything other than, well, learn to live with your child. And she, like all mothers, saw who her son really was and was determined to bring him out from wherever he was. So she kept looking, and what she kept finding as a neurologist, she was dealing with a lot of people with serious psychological illnesses, psychoses, etc. And what she noticed is a whole lot of these folks had really bad guts. They had gas, diarrhea, irritable bowel syndrome, Crohn's disease, whatever, but their guts were a mess. And she just started putting the pieces together because we have known for years that many people in the United States have what we call leaky gut, which means our guts are just not in good shape. They don't contain food the way they should. Particles slip through the gut wall that are too large. They should have been digested into smaller particles. And the minute they get through the wall in that sort of large molecular structure, our body does not understand what they are. They consider it an invasion from the army, and an invasion. And so send the army to deal with it, which is another word for inflammation. So the body becomes inflamed. So where Dr. McBride centered in on are those that become inflamed in their neurological system. Since then, she's in the process of writing her second book called Gut and Physiology Syndrome, because what she's realized, and all of us can see this in our whole family lines, you can see your family line as to what seems to be the weak spot. Oh yeah, my family all gets migraines, or my family's all got weak stomachs, or my family has skin issues. You can see that going on. And so what she found out was, no, it's not just gut and psychology syndrome. There's certainly some people where the neurological system is most affected by the imbalances in the body, but pretty much other systems go down as well. And it all centers around the gut. So we're going to get into that more and more. But this whole concept was created by Dr. McBride as she began to work with her son and with her patients, but she was able to reverse the autism in her son, and she's gone on to reverse autism and, boy, just about any illness you can think of, but certainly autism, ADD, ADHD, asthma, learning disabilities, behavioral disabilities, all kinds of stuff. So she's doing some amazing work over in Great Britain, and I'm just proud to have been taught by her and being able to share this information for you. So here is the quote that you want to really get nailed into your head, and that is, all diseases begin in the gut. And that was Hippocrates, like 400 BC, and I'm not sure we progressed much further. Hippocrates really nailed it. What we have now in the year 2013 is we now have proof that what Hippocrates said was true. So we can give you all the molecular data, we can give you all the scientific reasons as to why, and this talk is going to go into that in more depth. But truly, if you're not well, you need to really pay attention to what's going on in your gut. So moving right along here. So gut flora. This is what we're going to be talking about a lot. Now, I want to give you this great visual. In your gut, there's about 4 pounds of microbes, and that's bacteria, yeasts, and fungi. All right. Now, people, think about bacteria and yeast and fungus as bad guys, but they're not. There's good guys and bad guys, and there are actually bad guys hanging out in our gut, and they actually have a function as long as the good guys are winning. The good guys need to keep everything in order, and that's when the order gets out of order, that's when all things start breaking loose and creating illness. So now, that 4 pounds, it's about 4 pounds of matter in your gut, represents over 90% of all cells in your body. So as Dr. McBride says, basically, she has a great way of putting it. She says, yeah, so we're just 10%. Only 10% of the cells in our body are really our genetic material. 90% are microbes, other genetic material. It's not us, guys. So basically, we're a shell providing a habitat for this mass of microbes. So there's a nice visual for you. Their role in our human physiology is absolutely monumental, and as Dr. McBride so pointedly puts, we ignore them at our peril. So in a healthy person with a healthy gut flora, this mass of microbes is dominated by the beneficial and or probiotic species. So the beneficial guys are the ones that everybody says, oh yeah, when you take an antibiotic, you're supposed to be eating yogurt or taking probiotics to help the good guys back. And so those are the essential or beneficial flora that we're trying to keep up into a good condition in the body, and they're critical. The second group is the opportunistic flora, and the opportunistic flora is just what the word says. They are what I would call the bad guys. They are opportunistic. The minute an antibiotic comes in and wipes out the good guy bacteria, the opportunistic flora will take over. Now, I'm living in Florida right now, and in Florida it is just great. It's a great way to see opportunistic flora take over, because mold in any warm, damp climate is one of those opportunistic flora. And I'm not talking about inside your body, although actually that does pertain, but outside in Florida, you can watch. The minute mold gets a chance to take hold, it takes hold, and it is very reticent to get lost. You can try all kinds of things, but opportunistic flora very much like to take over and stay in that position. So that's pretty much what we're dealing with. We're dealing with the balance between the essential or the beneficial flora and the opportunistic flora. The transitional flora, the third category of flora, are pretty much just visitors. They're coming and going. They enter through your mouth. The body really doesn't deal with them at all. It just shoots right on down the tube and out the other end. So that's what transitional flora is. So in the next slide, we're talking about the roles of gut flora. Here are all the roles of gut flora, and I'm going to speak them because if you're a mother like I am, you might be listening to this rather than watching it because you're driving around trying to handle 500 things at once. And that, again, is the reason I'm doing this. I just know what women are dealing with these days, and especially with a special needs child, your time is very precious. So you can turn me on and off, stop me, and start me when you can. So the roles of gut flora, the first one is protection from invaders. Our gut is amazing at keeping us healthy. 80 to 90% of your immune system is in your gut, is created in your gut. Did you get that? 80 to 90% of your immune system is created in your gut walls. So all that beneficial bacteria create antiviral, antifungal, antibacterial, anti-cancer, all that stuff. They just kill it off and send it on its way. So the second role is health and integrity of the gut. Again, when the beneficial flora is in place, It keeps your gut wall in really good shape. There's really good glue it sets up to make your gut very tight so that all the digestion happens in the proper way. It's just a wonderful thing. So the third role is appropriate digestion and absorption. I'm not sure there's anybody left in the United States of America that really does have appropriate digestion and absorption, and you'll get that by the end of this talk, that all of us have compromised guts because of how we've chosen to live. At any rate, appropriate digestion and absorption just simply means that your stomach is able to properly break down the food, and then your intestine, your small intestine and large intestine, are able to complete that process. And again, if the bad guy bacteria are winning, that absolutely does not happen. Vitamin production. Did you know that your own gut is sort of a multivitamin producer, especially the B vitamins and vitamin K? Now, how many people have talked about, I'm under so much stress, I need more B vitamins? Well, no, actually, you need a really good gut. So we're getting down to the guts of the matter. That's why I'm going to call all you guys gutsy moms. We're going to start a gutsy moms club. At any rate, so vitamin production, your body produces its own vitamins if your gut is in good shape. Detoxification, huge, huge topic in the GAPS diet. And GAPS, by the way, stands for Gut and Psychology or Physiology Syndrome, GAPS. All right. Detoxification, huge. One, we're being exposed to a ton of toxins in our environment, but most especially by our gut. Because when your gut is out of balance, it produces its own toxins, and on top of that, then you get all the toxins from any processed foods that you're eating, and all the other environmental toxins that you're being exposed to. So a gut that's in good shape, tremendously efficient at detoxifying. Our bodies really know how to do that. It starts in your gut. Your liver finishes it off. You should be able to detox, most anything when you're in a really healthy state. So, and the last role, excuse me, get a drink here, is immune system modulation. Immune system modulation just simply means that it's what I said, 80 to 90% of your immune system is created in your gut. Your gut is a profound contributor to the status of your immune system. So the better your immune system, the better everything. Sorry, that is a phone call coming in. I'm going to ignore that. Isn't this great? I just can't anticipate everything, but it'll be over in a minute. All right, the next slide is what can damage there. I think it's done. All right, what can damage gut flora? There is a whole list. If you're not looking at this, I'm going to go through them one at a time, but we're talking about 14 different points here. The first one is antibiotics. We all know that antibiotics kill off the good guy bacteria as well as the bad guy bacteria. And the minute you take an antibiotic, the opportunistic flora are going to start taking over, and they are very successful at that. So if you've ever had any antibiotics, your gut flora is probably out of balance. Steroids, the birth control pill. Who knew? How many women have been on the birth control pill? And did anyone tell you that this is going to create a whole gut imbalance? No, the answer is no. And there are many women that talk about, just tremendous psychological issues with the pill where you just don't feel right psychologically. And again, there's that effect of the gut affecting the psychological well-being of the woman. So any kind of steroid and the birth control pill do affect your gut flora. Other drugs, pretty much any prescription drug is going to affect the well-being of your intestinal tract. And that's basically because our drugs are so concentrated and so potent that they do seem to shock the system. Stress. So I think this is more sort of unrelenting stress. So if you've been dealing with just an ongoing stress that just hasn't let up, then probably your intestinal tract is not in great shape. Poor diet. Now I'm going to find that as the basic all-American diet. If you're eating like most Americans, that is considered a poor diet. If there's any white flour and white sugar in your diet, you're eating a poor diet, and that just that creates a gut that is way out of balance. Infections, if you've had a serious infection, and especially any gut infection, if you've had food poisoning or MRSA or any of those things, you've got tremendously damaged gut flora. Disease, basically just an ongoing serious disease, that'll have its effect. Bottle feeding, huge. Babies that are born and never get breast milk. And I know this is hard for you to hear, but I think it's important to at least know. They've checked out their immune systems. There's no question that a baby who has been bottle fed from birth has an immune system that's a notch below a baby that's had breast milk. So a breastfed baby is by far has by far a stronger immune system and is better able to cope with all kinds of things. So bottle-fed babies are always sicker babies. If there's any chance, do not bottle feed your baby. Avoid it at all costs. Old age, well, just things start breaking down with old age no matter what. Now, I actually wonder about that. I think it's old age because they're looking at Americans, and in old age, if you're eating American food, you probably have lousy gut flora. I'm not sure I totally believe that. I'll have to go back on the mat with Dr. McBride. But as we age, we know things begin to break down. That's no question. So I guess old age can bring on an imbalance in the gut flora. Pollution, if you're exposed constantly to pollution and radiation and alcohol and toxic chemicals, those are a whole list of toxic substances that enter the body and create an imbalance in your gut flora. And then dental work. If you've had dental work and you have silver amalgams in your mouth, every time you chew, if OSHA, if you know what OSHA is the government group that comes around to manufacturing joints and tests their air to make sure that it's not toxic with heavy metals or whatever they're dealing with. And if you have amalgams in your mouth and then chew something and then have someone measure the air that's in your mouth, most people with amalgams would fail an OSHA test. In other words, you would not be allowed to go to work in your own mouth. So think about that. And that has some profound effects on the body and the body's ability to deal with toxins, and it also damages your gut flora. There you have it. So that's the whole list of those things that damage your gut flora. So the next slide, if you're not looking at this, imagine little fingers sticking into your gut wall. I don't know if you've ever seen pictures of coral reefs where they're sort of waving in the breeze. It almost looks like waves of grain, when they show those wonderful scenes of the wheat fields in the United States of America, waving in the wind. There's a real similarity to thinking about the inside of your intestinal tract and all these villi, which are little fingers sticking out. And inside the finger, just kind of like the fingers in your hands, are these veins that lead into and through the gut wall, basically. But all along the outside of the fingers are these little hairs called cilia, and those little hairs are part of cells called enterocytes, and they are waving in sort of the interior of your intestinal wall and catching the food and breaking it down properly and then digesting it. So that's what a healthy villi looks like. It looks like a finger just sticking into the basically the center of your intestinal tract. I'm sorry, those little hairs are not called cilia, they're called microvilli. It all rhymes. Or the other term for it is brush border. Each of these little hairs has enzymes that are sitting on it with them, and they help further digest the food. Now, the next picture is giving you just one little villus and showing you the lifespan of an enterocyte. And the enterocyte, as you can see at the beginning, is born sort of in the valley between the two fingers, and then it moves up. There's a real pace to the maturation of an enterocyte cell. And so as they move up the finger and get to the end of the finger, well, by the time they're at the end of the finger, they've died off. So about 3/4 of the way through, they're sort of mature, and they're maturing more and aging, and then they die off and are replaced with the next one coming up. So animal experiments when they sterilized the gut found that when the beneficial bacteria living on the intestinal epithelium are removed, this process of cell renewal gets completely out of order. The timing of the cell travel from the bottom of the valley up to the top gets it actually gets longer. It takes longer for the cell to mature, and then these cells often turn cancerous. So there are just many things that begin to happen when those cells get out of whack that create all kinds of pathology or disease in your gut, and cancer is just one of them. So when the bacteria is out of balance, not only are you not producing these enterocytes the way you should, but those villi, the fingers, sort of degenerate, and they're unable to absorb and digest food in all the proper ways. So you're getting then basically, so what I'm looking for, vitamin deficiencies, all that good stuff. This is how it all starts. So that's the picture of your villi. All right, now the next picture is a healthy enterocyte versus a sick enterocyte. So envision just a smiley face with really, really cute hair sticking straight up. Looks like a really healthy afro. And then a thick enterocyte looks very shriveled, and it looks like an old bald man, basically. And that's what they look like in a microscope. So all those really healthy villi that are supposed to be grabbing onto the food and digesting and absorbing it, with a thick enterocyte, there's just nobody home. There's nobody to digest and absorb, and everything just gets altered in a profound way. So anyone that's got thick enterocytes simply cannot digest and absorb very well. So in the next slide, we've got what happens with a damaged gut wall. Well, if your gut wall gets damaged and the gut begins to deteriorate, you've got a lack of protection by the beneficial gut flora. You start getting attacked by pathogenic microbes and toxins. Those are the bad guys. So they're going to start moving in, period, and start doing their damage. This is when those cute little enterocytes start degenerating. They start turning into little old bald men, and your tight junctions open. What happens with the bad guy bacteria is it literally chews up the glue that's in the wall of your intestine, and that's what creates the leaky gut. So that's why she says the tight junctions open. So now your foods are absorbed, partially digested. I'm sorry, I'm reading her slide, and to put it in a sentence, basically, foods are not absorbed properly. They're partially digested, and that's what leads to food allergies and intolerances, because they sneak through the wall and the body reacts. So that's the beginning of food allergies and food intolerances. When this continues to go on, your damaged gut lets toxins and microbes into the bloodstream. All right, and then what you've got is a general toxicity in the blood and in the body. So you've got toxic blood just running through the whole body, creating havoc. And it's going to create havoc mostly in the place that you genetically have a weak spot. And that's pretty much, people say, yeah, it's all genetic. And I'd say, no, the predisposition is genetic. You can turn the switch on or off depending on what you're eating. And that's what we're seeing over and over again. So, and finally, the immune system starts reacting, and if it continues on long enough, you end up with autoimmunity. You end up with the body simply not recognizing who's them and who's me, and the body simply starts attacking itself. And that's when you have illnesses like diabetes type 1, multiple sclerosis, lupus, all kinds of things like that. Okay, so here is a typical GAPS scenario child. All right. First of all, as Dr. McBride has seen over and over and over again, and I have certainly seen it in my clients as well, this is not something that just pops up. You don't just all of a sudden have an autistic child. If you look back in the family history, mom's had some issues with her gut, whether she knows it or not. Some people are asymptomatic. They just don't have symptoms. But most of them actually do, if you listen. And her mother usually had some gut issues. And so grandma usually had sort of really minor issues. Mom had kind of issues. And then now the baby's got even worse issues. So you've got a mother with gut dysbiosis. And dysbiosis just simply means that the material in the gut is out of balance. The baby then does not develop normal gut flora. And let me explain that a little bit more. When a baby is born, well, no, let me back up. In utero, a baby's gut is sterile. Upon birth, as the baby's going through the birth canal, the baby swallows some of the mother's vaginal fluid. Now, that vaginal fluid is a direct reflection of the mother's actually own gut, and actually the father's gut as well. So people say, well, how did the father get in there? Well, the mother and father exchange fluids. That does go on. So the mother's gut is a reflection of both. And so if it's good news, if the mother's gut and the father's gut are really healthy and in good shape, then the baby is being inoculated with all the right stuff. And that's what creates a very healthy, hearty baby. If, however, the mother's gut is out of order, and or the father's gut is out of order, the baby is now being inoculated with all the bad guy bacteria. So the baby's off and running with an immune system that's compromised. And that's the next point. The baby's immune system is compromised. So now you get a baby. Now often these babies, if they're nursed, if they're on breast milk, often they'll get through the nursing process with no problems. And again, that depends on the child, because I've seen many babies that are not thriving with nursing because they have the same food allergies that the mother does. So the mother's got to get off the foods like gluten or dairy in order to get the baby to not have reflux or be able to sleep or whatever the symptoms are. So the immune system is compromised. With a compromised immune system, now you have that baby that has ear infections, chest infections, and what are they given? They're given antibiotics. I agree. So again, what I'm finding is many mothers just assume that, well, this is just the course of events. Children just get sick all the time. I want you, please, to get that out of your head. That is not what normal child rearing involves. It just should not involve a sick child at all. You should basically be able to raise a child with home remedies and see the doctor once a year for a well visit. That's what a normal, healthy child should be like. And we have become dulled down and have gotten into this thinking that, yeah, ear infections and getting colds all the time is just part of being a kid. And I just want you to realize that that is so not true. I raised 2 children where they just never saw doctors. You just don't need to do it. Promise. Okay, so now you got ear infections and chest infections. You've already started with the gut that's kind of out of balance. Now they're given antibiotics, which further deepens the imbalance in the gut and deepens the imbalance in the immune system. And then they're given vaccinations. And I can tell you that I would highly recommend that you educate yourself deeply about vaccinations, what's in them. The bottom line is we are mainlining, injecting some very toxic substances into a very young child's system before they've developed their own immune system. I my personal opinion after reading what I read was to not vaccinate my daughter at all. So these are decisions that parents have to make, but I would not make that decision lightly. Make sure you read up on what exactly is going on with vaccinations. What Dr. McBride says is that what happens with vaccinations, many people accuse vaccinations for creating the autism or the learning disability in their child. What Dr. McBride postulates is, well, you probably already had a baby that was running a whole lot of toxins through their system already. And pretty much the vaccination was the icing or the straw that broke the camel's back. The baby had a lot of toxins to begin with, and that was just one too many. So, again, if you have a strong immune system, you might be able to buffer those vaccinations, but you're kind of full of roulette there. It's a chance. If there's any history of gut issues, autoimmunity, psychiatric issues in your family, I would think extremely long and hard about whether to vaccinate or not. And then after vaccinations, we do the usual weaning diet, and often that's a bunch of white flour. Cream of wheat for babies, that's white flour. The rice cereal, that's white rice. And people just will give their babies sugar and white flour and all kinds of stuff, which further damages the gut wall. So now you've got a damaged gut wall, and that creates on its own extra toxins, microbes. You've got undigested foods. They're all entering the body. The toxins then enter the brain, which cause gut and psychology syndrome, and the toxins entering other organs cause gut and physiology syndrome. So and that's why we're seeing a 1,500% increase in autism in the last 10 years, a 400% increase in ADHD, and a 400% increase in autism. It's right here, guys. It's not that complicated, and yet in our society, it kind of is. So I'm going to give you now a typical GAPS scenario of an adult. Usually they're a GAPS kid. If you look back in your history as an adult, you probably can see where all those signs and symptoms were. Antibiotics and other influences have damaged the gut flora as you were growing up. You've had abnormal digestion and absorption of food that has led to lots of nutritional deficiencies. And then now you've got the gut dysbiosis, which leads to a damaged gut wall. Now you've lost all that glue in your gut. You have a leaky gut. Now you've got toxins and microbes and undigested foods entering your body. You get in the picture? It's kind of the same. And as an adult, you've got food allergies and intolerances. Your immune system just is not working very well. It's quite compromised. You may have moved into autoimmunity. It depends. And now the toxins enter your brain for gut and psychology syndrome, or the toxins enter other organs, causing gut and physiology syndrome. And that's where you're at as an adult. So, again, what I have loved, and that's sort of the end of the introductory lecture, in this series, and I want to invite you, I'm going to be creating the full series of 10 more talks that bring you right through the whole process of, well, how do I get myself out of this mess? And Dr. McBride has laid it out very clearly. I highly recommend you get a hold of her book. That is the last slide here, or the second to last slide in this talk. But her book, Gut and Psychology Syndrome, you can get that on Amazon. I highly recommend that for reading. And I am here to help you. I'm physically here in Lakeland, Florida, but I'm also online. I do Skype appointments, and I can really help educate you on how to start making these changes. I work with a cook. I am someone who is absolutely devoted to fast, quick, and easy. I'm not someone that spends every day in the kitchen, but I will say to you that one of the lifestyle changes that must, and I repeat, must happen, is that you have got to reclaim the kitchen as far as cooking food. You've got to be able to cook food. You cannot eat fast food, eat out all the time, all it does is create disease. And I think if you're listening to this, you've probably experienced that to enough of a degree that you're looking at maybe making some changes. So I wanted to define one of these terms on this slide. It talks about autism dyslexia, which means you reverse letters and numbers, depression, and anxiety, by the way. That's not on the slide. Dyspraxia means clumsiness. It's kids that are always accused of just being, clumsy fools. And they're not at all. It's dyspraxia. It's a neurological result of toxins in the blood. ADD and ADHD and schizophrenia. Dr. McBride has reversed schizophrenia with this diet. So what Dr. McBride, again, what I appreciate her is she's been a mom. She's also a clinician and a researcher, and just cares a ton about her patients and has reversed all these disorders with food alone. And I invite you to join me for other of my programs that will describe more in depth exactly what foods are used to reverse this process. But it is possible. There are many people who have been able to do this, and Dr. McBride was one of them. And the last slide just gives you a couple of sites that you can go to. Gaps.me is a great site full of all kinds of good stuff, and Dr.Natasha.com is on Dr. Natasha's site. So I hope this has been informative. I welcome any email questions, and you can call me at my phone number, which is area code 863-874-0407. And I'd be glad to talk to you for a few minutes, give you an idea of what all is involved in a GAPS recovery. So, carry on, and thanks for the opportunity to teach you. I love teaching. Ciao.